Hello, how are you doing today? I'm
Good.
Arthur. I'm gonna be your nurse. Says here your name's Sandra,
Yes, that's
correct?
right.
Do you go by Sandra?
I do.
Excellent. So you were admitted here because you had your first asthma attack, and your doctor has prescribed you some medication to help you with some of those symptoms that you experienced right before you had that asthma attack. Could you go ahead and review what those symptoms are when you feel like you're about to have one?
Yeah. I had some tightness in my chest and coughing fit, and felt like I just couldn't get a breath in. And it's very scary.
So those are some of the classic signs of an asthma attack. You feel tightness in your chest, shortness of breath, like you said. You know, you might have some coughing or wheezing to associated with those attacks. So what this medication, albuterol, is going to do is going to try to alleviate those symptoms and prevent those asthma attacks before they take place. All right. So what I have here for you, because it says you said you never used, right? You never had this medication before, right? You never used an
I've seen
inhaler,
it before. in my
right?
life.
So I printed out some directions with pictures for you of how you're going to utilize this medication, and we're going to go over it step by step. And then when I'm done demonstrating it, you're going to demonstrate how you're going to use it back to me. Okay? Clear? All right. So this is a meter dose inhaler. There's a little number counter on here that goes up to, on this particular one, 200. So it lets you know how many puffs you've taken of the medication. So when it comes time, getting close to a refill, you're about to, get to that number 200. You want to make sure that your next rescue inhaler is ready to be refilled, right? That you have enough refills on it. So that's important. All right. Um, as far as this medication goes, there's a little cap on here, right? So when you're ready to take the medication, you're going to go ahead and take that cap off. And you can regularly clean this area, like maybe once or twice a week. Run some warm water over it, and that'll make sure that you keep the mouthpiece clean, free of germs. Right. So you're feeling some of those symptoms we talked about. First step you're going to do, and it's an easy one to forget. All right, the medication can settle out. Right, so all the medication can drop down to the bottom of this canister. So what you want to do when you're ready to take your medication, you want to shake it up really good. Right, so that's step number one. Right. Then I'm going to remove my mouthpiece.
So I shake.
Right? So yeah, shake it up real good first. Then go ahead and remove the mouthpiece. Take a deep breath in and just clear out your lungs. Big exhalation, right? So I've cleared all my lungs out. I'm ready to take my medication. That's my next step, right? So step one, I shake it up. Step two, I've taken off the mouthpiece. Step three, I've done a big exhalation, right? I've cleared out my lungs. And I'm going to go ahead and move on to step four, where I place the mouthpiece in, and I go ahead and push down all the way on the cylinder, right? And when I'm pushing down on the cylinder, I'm taking a big inhalation, right? I'm going to inhale as much as I can, get the medication in. Now, step five, you're going to hold in that medication for about 10 seconds, right? All right, so 10 seconds, go 1 Mississippi, 2 Mississippi, until you get to 10 seconds, and then you can go ahead and exhale, all right? Now, on this medication, you've been prescribed 2 puffs every 4 to 6 hours as needed, right? So that was your first puff, right, in those first steps. Now, what you're going to want to do here is wait a minute between dosages, right? So I'm going to wait 1 minute. I can have a stopwatch or just, count 60 in my head, and then I'll go ahead and repeat steps 1 through 5 and take that second dose, all right?
Okay.
Once you've taken that second dose, you can go ahead and just wash your mouth out with some water, right, for a few seconds, just gargle with some water, and that just gets rid of any remaining medication in your mouth, right, because we want the medication acting on your lungs, right, your airways, okay? All right, so we went over a lot of steps here. What I'm going to want you to do is go ahead and demonstrate to me how you're going to take your medication. So you're feeling some of those symptoms you've had for asthma attack, feeling that shortness of breath, you got your rescue inhaler. Can you go ahead and demonstrate how you're going to utilize it?
Right. So, wheezing, feeling, all that stuff. First things first, I'm going to shake it and make sure that it doesn't settle on the bottom. Then I'm going to take the cap off. I'm going to take a big breath in, breathe it all out. I'm going to put it to my mouth, push it down, same time that I breathe in. And I'm going to hold the breath for 10 seconds. And then I'm just going to exhale. And then because I have 2 puffs, I'm going to wait 1 minute and then shake it again. Repeat all the steps. Take a second puff. 10 more seconds. And then I'll put the cap back on, and then I'll rinse out my mouth and
Just with some water.
go
Alright.
about my day.
Perfect. All right. That was a great job. Do you have any questions about your medication?
Yes, I was wondering, what are some side effects of taking this regularly?
Right. So, because it's the first time, it's going to kind of feel perhaps like you've had a cup of caffeine, like a cup of coffee. All right. So, you might feel a little bit nervous, a little bit restless. You might notice that your heart rate has increased a little bit, perhaps different rhythms in your heart. And depending on what time of the day you've taken your inhaler, like let's say you take it at 11 o'clock at night when you feel like you're about to have an asthma attack, it might prevent you from feeling tired. So you might feel what we call insomnia, right? Just like having a coffee really late at night.
Okay.
All right.
Does that mean that I should drink less coffee while I'm taking
That
the
might be
medication?
something you want to discuss with your doctor, right? Because if you start feeling some of those symptoms, those side effects, right, that that we expressed could occur with the medication, then perhaps combining it with caffeine might not be the best idea, right? But that's not necessarily something you're going to feel as far as the side effect goes, but it's something that's possible, right? So we went over a lot of information again with the side effects. Could you tell me what side effects you would expect to potentially feel?
It could feel like having a cup of coffee. I could have my heart rate could go up. I could have some nervousness, and maybe if I'm going to bed, I might have trouble falling asleep and stuff like that.
Not guaranteed to happen, but you want to look out for those side effects. And just like we talked about with you kind of keeping track of how much medication you've taken with your rescue inhaler, that's something that you can keep track of as well. So if you experience some of those side effects.
Do you recommend that I keep like a journal and keep track of
Absolutely, right? Keeping a journal of some of the side effects you've experienced and how often you're using a rescue inhaler can be really valuable when you come in for your next visit and you talk about how effective this medication has been for you. Okay? All right. Any other questions, Sandra? All right, we're going to go ahead and get you discharged here. This is going to be for you to keep. I'll put that in a bag for you, and we'll get you on your way. I hope you feel better. All right, thanks so much. You have a great day.